Let's bring in Dr. Aditi Nerurkar. She's a physician at Harvard Medical Center. So, doctor, let's talk about the pushback against vaccine mandates. When you see a state like Texas issue a ban on mandates, do you think this impacts overall confidence in the vaccine? I mean, what are your thoughts about this move by Governor Abbott?
You know, Joe, this is such a disservice to public health. Vaccine mandates are being used as a political tool, but we know that they are simply public health measures. As Miguel reported, only 50% of Texans are currently vaccinated. If we want that number to change, we must instill vaccine mandates. And unfortunately, with this particular law, this isn't, favorable. The good news, however, is that federal agencies like OSHA can override the governor's decision.
Doctor, let's talk about the holiday season coming up. We're seeing a drop in cases right now, which is, of course, good news. And Dr. Anthony Fauci has already said we can celebrate Halloween safely and other outdoor activities. But what about Thanksgiving and Christmas when we're spending more time indoors likely?
You know, Savannah, I think the holidays this year are going to look very different. And for fully vaccinated families, there could be a real semblance of normalcy. We're waiting on official CDC guidelines. We should have them in the next week or so. They were updated as of Monday to have a better sense of what the national policy is going to be for us to enjoy holidays safely. But if there was ever a time to get vaccinated, now would be it with the upcoming holiday season and flu season approaching.
Dr. Nerurkar, the FDA has a lot on its agenda right now. Boosters this week and later this month, vaccines for younger kids between the ages of 5 and 11. How should the U.S. prepare to vaccinate more kids? So, Joe, this is a really important consideration. Only 25% of parents right now are ready to vaccinate their children, and 40% are still on the fence. So we must do more to engage parents. We also have to engage pediatricians' offices and make sure that the vaccine is available in doctors' offices. This was not done with the adult vaccine, and I think this was a misstep, and I think we're going to be correcting this for the future when it comes to vaccinating kids. All right, Dr. Aditi Nerurkar, as always, thanks so much for your expertise. We appreciate it.